Welcome, and thank you for joining us for this virtual information session for the Leadership Exchange for Adolescent Health Promotion. My name is Christy Altador, and I serve as one of the project directors and technical assistance advisors for the LEAP project. We wanted to share a disclaimer before we got into our presentation today. Development and presentation of this webinar was supported by a cooperative agreement with the Centers for Disease Control and Prevention. The opinions, findings, and conclusions do not necessarily represent the views or official position of the U.S. Department of Health and Human Services or the CDC. Our objectives for today are to provide more detail around the goals and objectives for LEAP, offer clarity on what would be expected if your state team chose to participate, talk through the types of stakeholders that you will include on your state team, and understand the benefits of participating in LEAP. We wanted to start off with some introductions. Like I shared earlier, my name is Christy Altador, and I serve as a Senior Manager for Adolescent Health at the National Coalition of STD Directors. NCSD is a national public health membership organization that represents health department STD programs and community-based partners across 50 states, 7 large cities, and 8 U.S. territories. We work to build the capacity of the field through technical assistance and training, resource development and dissemination, policymaker education, and peer-to-peer learning opportunities. I'd like to introduce you to the Child Trends and the National Association of State Boards of Education, or NASB for short. I'd like to introduce you to their teams. Child Trends has been a leading institution in the effort to improve the lives of all children and youth through research. NASB elevates state board members' voices in national and state policy making, facilitating the exchange of informed ideas, and supporting members in advancing equity and excellence in public health education for all students. Child Trends has engaged NASB as a subrecipient. NASB will also provide technical assistance to state teams and assist in developing tools and resources. We are pleased to be joined on this project by a number of national organizational partners who serve on our project advisory board. These are the Association of State and Territorial Health Officials, Cardia Services, Council of Chief State School Officers, GLSEN, National Conference of State Legislators, National Governors Association, Society of State Leaders of Health and Physical Education, School-Based Health Alliance, and the National Association of School Nurses. This map reflects the states that are currently enrolled in LEAP. Please note that over the course of this 5-year project, we will have extended an invitation to all 50 states and the District of Columbia. Your states were invited to be a part of this project due to your existing leadership, interests, and/or stated need for more support on adolescent health. Throughout this presentation, you may hear us reference SHE, SHS, and SSE. These are the 3 arms of adolescent sexual health around which CDC- focuses its efforts. LEAP will be thinking about the policies that impact some of the following. For sexual health education, we're going to look at topics that include sexual health curriculum, content and accessibility, teacher preparation, and professional development. For sexual health services, we're going to look at access to contraception, access to HIV/STI testing, availability and use of school-based health centers, minor consent laws, and the like. Safe and supportive environments will look at anti-bullying, school connectedness strategies, LGBTQ inclusive curriculum, GSAs, LGBTQ cultural competency for staff. LGBTQ stands for lesbian, gay, bisexual, transgender, queer, or questioning. DASH stands for Division of Adolescent and School Health. We're going to be talking about policy and practice today and throughout this project. So we'd like to provide a quick overview of what that means and what it might look like for you. Here we have a CDC definition of policy. We identify several types of policies, and each of which can operate at different levels. For legislative, we're looking at laws or ordinances created by elected representatives. This includes state or local legislators. Regulatory looks at the rules, guidelines, principles, or methods created by government agencies with regulatory authority for products or services. Organizational follows rules or practices established within an agency or organization. We wanted to share some of our goals for this project. First, we hope to build the capacity of state leadership teams to assess, develop, monitor, evaluate, and implement adolescent health policy for sexual health education, sexual health services, and safe and supportive environments. We hope to facilitate access to a network of national policy, health, and education experts. We aspire to strengthen state leaders' knowledge and understanding of adolescent health issues. And lastly, we hope to create collaborative and peer-to-peer learning opportunities for state leadership teams to share successes, challenges, innovations, and questions. So, what does this actually look like for you? Throughout this project, and particularly over the course of the next 2 years, we will provide virtual technical assistance to you and your state team. And we may offer meetings facilitation support and/or conference scholarships. On this slide, the blue column to the left includes the activities you'll be responsible for. The items in the green and orange columns represent everything that we will provide to support you throughout the process. Let's look at each phase a little bit more closely. Your state leadership received a state profile in their official invitation to join LEAP. The profile will provide you with a snapshot of the policy and data landscape in your state, and hopefully spark some initial conversations about gaps, priorities, and opportunities. The Capacities and Opportunities Assessment is a tool to help us figure out the best ways to support you in this process. It can also help us identify strengths where your experience may be helpful to share with other teams in your cohort. In order to tailor the technical assistance experience, representatives from state education and health agencies will be asked to fill out a Capacities and Opportunities Assessment. This tool will help your dedicated technical assistance specialists understand your agency's collective capacity to move the needle on adolescent sexual health in schools at the state level. Next, we will host a kickoff TA call with the team and the TA advisor to review profile and assessments prior to the virtual training. We'll have an overview of your state team, your state's policy landscape, and questions and resources you have going into the virtual training. We recognize the power of partnership between public health, education agencies, and other partners to reach sustainable outcomes. For this project to work, we are looking for the movers and shakers at your agencies, the folks who are in a position to make decisions and/or set priorities for policy and practice. Our original invitations went to the state health commissioners and superintendents for this reason. We've received questions from a number of you about who is the appropriate representative for your agency. And we suspect that the invitation has already been delegated in many instances. We are supportive of your participation on this project, but ask for leadership buy-in and engagement. We know that many of you are going to be joining us as a representative of your state health department. We will note that invitations went out to your agencies along with the state education agency. We will need participation and buy-in from both to move forward on this project, and would encourage you to connect with your colleagues there to ensure that your state is represented. Specifically, you will have a core team made up of at least 3 members. These include the State Health Department, State Education Agency, and/or State Board of Education, and at least 2 other stakeholders that you can identify. Previous teams have included other state agencies, statewide coalitions, nonprofit leaders, key representatives from a school district, advocacy partners, and others. In terms of who from your agency should participate, we are looking for folks with some level of decision-making authority to be engaged in some way, while also looping in the folks within their agencies that have subject matter expertise in these areas of work. Examples from previous teams include Chief Health Officer, from a major school district, HIV/STD Division Director, Education Consultant, Associate Commissioner for Student and Family Support, Bureau Director for Public Health, and Executive Director of a nonprofit. Some groups that you might consider engaging include parent organizations, youth organizations, LGBTQ+ serving organizations, substance use and mental health organizations, and statewide coalitions. We hope that in your team, you will learn from one another, address overlapping needs, represent with interest in adolescent sexual health, define and anticipate legal and policy issues, and share resources and best practices. Each state will be invited to engage members of their state team to join our virtual training. The virtual training will be an opportunity to learn how to engage with the CDC policy analytical framework identified here, identify policy gaps and opportunities in your state, develop a state action plan, network with other state leaders, hear from expert panelists and state legislators, and receive personalized TA from a dedicated TA advisor. Content will be a hybrid of modules with written content and recorded presentations, along with scheduled live virtual sessions with our panelists and TA advisors. There will be dedicated time for action planning with your state team. Here, we wanted to share some of our training and action plan goals. We hope that during this time, you will develop strong and sustainable partnerships between health and education agencies, use data to describe state-specific risks and protective factors in high-burden populations related to HIV, STI, and pregnancy among adolescents, learn to communicate to state-level stakeholders and decision-makers about what works to address adolescent sexual health, assess the current policy landscape, including existing statewide policies and practices, facilitators, and challenges to improvement, connect with existing resources from CDC and other partnership organizations, identify gaps between model policy and program implementation, prioritize policy issues to address as it related to HIV, STI, and pregnancy prevention, and lastly, develop actionable strategies to address current policy and implementation landscape. Here, we have a few reflections from our previous cohorts from our last in-person training. The LEAP team will provide ongoing technical assistance to state-level teams via a mixed methods approach. Your state team will be assigned to a TA provider who will provide targeted and specialized TA and content area expertise to support development and successful implementation of your action plan. TA will include the following: email, phone, quarterly all-state calls, subject matter expertise, peer-to-peer sharing via our Slack and share file, and resource library. You will receive more intensive technical assistance for up to 2 years, with an opportunity to continue to engage with us to a lesser extent after that time. Here, we wanted to share a time commitment for LEAP. Our virtual training will be an asynchronous learning at your own pace. Scheduled live events with TA providers and national experts will be provided at the time the state team is enrolled. We will hold bi-monthly TA calls where the LEAP team will schedule 1-hour bi-monthly calls to discuss project updates, challenges, and successes. You may also call us at any time with targeted questions. And lastly, for our quarterly all-state calls, those are about 90-minute quarterly listening sessions and communities of practice. Thank you for your interest in joining our LEAP project. We look forward to connecting with you soon.